We're speaking this morning with Dr. Johnnye Lewis with the University of New Mexico Health Science Center. Dr. Lewis, could you talk to us about some of the scientific research your center has been performing?
We focus mostly on metals and environmental exposures to metals largely from mine waste sources, dealing with the waste from 161,000 mines in the western U.S. Our primary focus has been on waste from uranium mines and how that impacts tribal populations, which often are co-located.
How did you determine this aspect of your research?
We actually were approached. I had been working with tribes for a fair amount of time. And we actually had members of 20 chapters of Navajo Nation come to us with questions about the fact that they had such high rates of kidney disease, and they knew they also had exposures to uranium because uranium was mined there so heavily up until 1986 when the last mine closed. And so they were concerned that the ongoing exposures to the waste left from those mines, which have never been cleaned up, was contributing to the rates of kidney disease and the very early onset. They had teenagers on dialysis, and this was 15 years ago, 20 years ago. And the rest of the country's kind of caught up over time, but they, at the time, had both the highest rates and the earliest onset. They also drank a lot of unregulated water because 35% have no access to regulated water. So they figured uranium could be in the water, that could be causing the kidney disease.
Who supports this research? Where do you get your funding from?
Primarily from the National Institute of Environmental Health Sciences. They've been really supportive of doing research on environmental health disparities. Disparities in populations that have high risk factors for development of disease like poverty, low socioeconomic status, low income levels, low educational status, often a pre-existing history of some disease. With Native Americans, there are also cultural aspects that can change the way exposures occur, and how people get exposed directly impacts what the outcome of that exposure would be. So NIEHS has really been the leader in funding that type of research.
What have we learned from this research?
With toxicology, you often see very different effects with high doses versus low doses, and the kinds of things that we get in these communities are very low dose exposures over very long periods of time. They encompass a lot of sensitive periods in development, like prenatal, early development, etc. CDC is actually now funding us to do a birth cohort study, which is adding to our knowledge. So with those data, we now have data on 3 successive generations of Navajos that have been exposed. And we've also worked with some other tribes, like the Cheyenne River Sioux, who have primarily arsenic exposures related to mines in the Black Hills draining onto their lands. What we've seen in both populations is an increase in autoantibody production, so precursor to autoimmune disease, and often also an increase in autoimmune disease itself. But that's a disease that takes a long time to develop. So we see the markers in very young population, and then in the older population we see increased disease itself. We also see increased cardiovascular disease and generalized immune dysfunction that are related with those exposures. So very primary things that can lead to a lot of other health effects.
Can the public use your research? Can legislators use your research?
Absolutely. Probably the best way to get in touch with us is either to contact me directly by email, which is jlewis@cybermesa.com. That's cybermesa.com. Or we also have a website, that they can use to contact or to update on the maps of what we've looked at and what we found, and that's healthyvoices.org. We have a new center that will actually be working with Crow Nation, with Cheyenne River Sioux Tribe, with Navajo Nation, and with some of the tribes in the Pacific Northwest, and that's called the Center for Native Environmental Health Equity Research, and they can link to that center through the healthyvoices.org webpage as well, and that also is funded by National Institute for Environmental Health Sciences.
Well, on behalf of the National Conference of State Legislators, I want to thank you for being with us this morning, Dr. Lewis.
And thank you for the opportunity.